The Ghana Health Service says 5 cases have been confirmed in the eastern, western and greater Accra regions. In view of this, MyJoyOnline.com explores ways you, our cherished reader, can stay safe. Origin: the monkeypox virus was first identified in the State Serum Institute in Copenhagen, Denmark, in 1958 during an investigation into a pox-like disease among monkeys. But it was first identified in humans in 1970 in Zaire, now known as the Democratic Republic of Congo, in a 9-year-old boy in a region where smallpox had been eliminated in 1968. In the spring of 2003, monkeypox cases were confirmed in the Midwest of the United States of America, marking the first reported occurrence of the disease outside of the African continent. Most of the patients had had close contact with pet prairie dogs. Infection results from direct contact with the blood, bodily fluids, or cutaneous or mucosal lesions of infected animals. Human infections have also been documented through the handling of infected monkeys, rats, and squirrels, with rodents being the major reservoir of the virus. Eating inadequately cooked meat of infected animals is a possible risk factor. Transmission occurs primarily via droplet respiratory particles, usually requiring prolonged face-to-face contact, which puts household members of active cases at greater risk of infection. Transmission can also occur by inoculation, or via the placenta. Congenital monkeypox. There is no evidence to date that person-to-person transmission alone can sustain monkeypox infections in the human population. Secondary or human-to-human transmission can result from close contact with infected respiratory tract secretions, skin lesions, open wounds/injuries of an infected person or objects recently contaminated by patient fluids or lesion materials. Duration: the incubation period, interval from infection to onset of symptoms, or monkeypox is usually from 6 to 16 days, but can range from 5 to 21 days. Monkeypox is usually a self-limited disease with the symptoms lasting from 14 to 21 days. Symptoms: the infection can be divided into 2 periods. The invasion period, 0 to 5 days, characterized by fever, intense headache, lymphadenopathy, swelling of the lymph node, back pain, myalgia, muscle ache, and an intense asthenia, lack of energy. The skin eruption period, within 1 to 3 days after the appearance of fever, where the various stages of the rash appears, often beginning on the face and then spreading elsewhere on the body. The face, in 95% of cases, and palms of the hands and soles of the feet, 75%, are most affected. Risk factors: people living in or near forest areas may have indirect or low-level exposure to infected animals, possibly leading to subclinical, asymptomatic infection. The case fatality has varied widely between epidemics, but has been less than 10% in documented events, mostly among young children. In general, younger age groups appear to be more susceptible to monkeypox. Diagnosis: monkeypox can only be diagnosed definitively in the laboratory, where the